Hi, I'm Dr. Cooley with COOLEY Natural Health Solutions. I'm going to talk to you guys just a brief introduction on inflammation. Inflammation is a huge aspect of any patient complaint, whether it's chronic fatigue, brain dysfunction, gut health, or just any injury. So elbow, shoulder, low back, anything like that, there's always going to be some chemical inflammatory component there. When it comes to inflammation, there's four big drivers as to why someone could be chronically inflamed. Number one is definitely diet right off the bat. So big things that contribute to why someone would be eating like a pro-inflammatory diet are going to be too much refined vegetable oil intake, and that's like soybean oil, so eating like fried foods, vegetable or salad dressing that has a lot of vegetable oil in it, eating out all the time, you're going to consume a lot of vegetable oil, and combining that with a lot of excessive insulin in your system, and your insulin gets driven from having too much carbohydrate intake. So basically the combination of too much refined vegetable oils and too much carbohydrate intake creates this recipe for too much inflammation. Ways to get that inflammation under control from a dietary perspective are: one, reduce those carbohydrates, reduce those refined vegetable oils, but at the same time increase those healthy fats in order to substitute for those carbohydrates. So those would be things like grass-fed butter, extra virgin olive oil, avocados, nuts and seeds, coconut oil, things like that. Number two, biggest cause of inflammation, and this is especially true for people who are already like very health conscious and like eat a fairly good diet, and this is infections. Now, a lot of people will be like, well, I'm not dealing with any infections, I'm not sick right now, I just have a lot of aches and pains over my body. We don't really realize that we're dealing with infections all the time, and how our immune system handles these issues has a lot to do with our overall inflammatory load. Number three is overtraining, and we'll say overtraining, overworked, because you can be have a fairly low stress lifestyle, but if you're working out too hard all the time, doing too much high intensity exercise, you're going to be overtrained. At the same time, you don't have to be exercising all the time to be overworked. So if you're working 12, 13-hour days, even longer than that, you're not eating good, you're constantly looking for coffee to get you through the day, there's a good chance you're overtrained and overworked. And then the last one, which actually goes along with the one I just said, it would be lack of sleep. So when you're sleeping, that actually is a good time for your body to heal. This is actually when you should be taking advantage of inflammation in your body, because inflammation really is actually the healing process. So making sure you're getting adequate sleep, being in a nice dark environment, those are all key things for breaking any chronic condition that's driven from inflammation. Where my treatment comes into play is when someone's looking at inflammation, there's so many different ways you can go about trying to fix it, and I can help someone guide them into finding the very specific solutions that they might need to get that inflammation under control. Maybe one person needs vitamin A to get their inflammation under control. Maybe another person needs vitamin D. Maybe someone else needs an antimicrobial herb. One that I use often is one called Morinda, and that actually works really well for getting inflammation under control. But it's hard to know what someone should take at any point in time, and my treatment helps to identify these things on a very individualized and thorough basis. For any other questions on inflammation, feel free to email me, or you can check out my website. I got a lot of information dedicated to this topic. Thank you.